Hello Candice ma'am and hi everyone. I'm Krishna Kulkarni and today I'm going to present the topic role of biophysiological factors in migraine. Coming to the definition, migraine is a chronic disorder wherein recurring attacks of headache occur with variations in intensity, duration and frequency. The attacks usually last for 4 to 72 hours with pulsating nature and is usually on one side of the head as shown in the picture. The attacks are usually associated with nausea, vomiting, increased sensitivity to light and sound, and it impairs the day-to-day lifestyle of the patient. Uh, and many biophysiological factors trigger migraine. But out of these, which one I have chosen is the hypersensitivity to visual, auditory, and olfactory stimuli. Coming to the hypersensitivity to visual stimuli. The visual hypersensitivity is caused mainly due to the light as the main triggering factor. It occurs in around 50 to 90% of the migraine patients. The type of the light would be normal light in the house, or bright light, which is also the sunlight, and the flickering lights, which are put on during festivals, occasions, or even traffic lights, and and last but not the least, the light which are emitted from the electronic gadgets such as mobile phones, laptops, television, and this light particularly is of blue light and of shorter wavelengths, which cause a lot of strain to the eye and aggravates the migraine conditions. The sensitivity to light is much higher than normal persons even after 3 days of recovery from the migraine. Coming to the hypersensitivity to auditory stimuli, then there occurs phonophobia, which is fear from sound, uh, and this affects around 52 to 82% of the patients suffering from migraine. Uh, the sound can be from the vehicular sound of the traffic and from the day-to-day sound of the utensils in the kitchen, the doors slamming in the house due to wind, and also people talking loudly in public in gatherings. And this sound it causes discomfort and headache, which normally it doesn't bother the other normal people, but it particularly affects the migraine patients. Even during asymptomatic period, patients experience more sensitivity than normal person. Increase increases during the episode of the migraine, particularly this kind of symptom. It aggravates uh, during the episode of the migraine. Coming to the hypersensitivity to olfactory stimuli, and here there occurs osmophobia, which is fear from the smell, and this occurs in around 25 to 43% of the patient. And the type of the odor could be from the scent which comes out from the perfume, deodorant, or even the smell can be coming out from the pungent odor of the food products such as uh, coffee, raw onions, and other fried products. Uh, and it could and also smoke coming out of the cigarette affects the migraine patients a lot, and it causes discomfort and aggravates the situation. And about 35% of the patients, the intolerance to smell occurs even in the absence of the acute phase of the migraine. Coming to the conclusions, among the trigger factors for migraine, visual, auditory, and olfactory hypersensitivity plays an important role, and one should be aware of the symptom of the migraine and should take precautionary steps. Uh, Treatment should focus not only on avoiding trigger factors but also taking medical uh, uh, prescriptions from the doctor. And research has shown that biochemical changes happen within the brain during the migraine attack. But however, the underlying causes of the mechanism of the migraine attack needs further study and is still under uh, study of the from the scientists. So this concludes my presentation, and these are the references. Thank you so much.